We're here today for part 2 of the Neuroplasticity for Tinnitus workshop. This is exciting because this will teach you how to achieve positive neuroplasticity for your tinnitus. This means you're going to experience positive changes in your brain and your nervous system structure to improve your life with tinnitus. Make sure you watch part 1 of this series because that was the foundation we're going to build off of today when we go into the details. This is part 2. Let's talk about what we're going to discuss today. So the table of contents here for part 2 for neuroplasticity for tinnitus, we're going to talk a lot about mindset and psychology. We're going to talk about meditation and yoga. I'm going to teach you how exercise impacts neuroplasticity. And finally, sound therapy for tinnitus and how that improves neuroplasticity as well. So, mindset and psychology. Our thoughts and beliefs affect the neural structures. Let's go back to the basics of neuroplasticity, is that when you have successive, repetitive practices or experiences, those neural networks strengthen in your body and give you a stronger ease and a stronger experience with whatever that is. So for example, mindset and psychology, if you're using positive self-talk, if the way you narrate your life to yourself is consistently more neutral or positive, then that will affect your neural structures. On the contrary, if you are very hard on yourself and blaming yourself for how you got tinnitus and why it's so bad, maybe because you went to a lot of loud music shows or you used power tools and didn't protect your hearing. Those are some common examples. If your mindset, if the way that you're talking to yourself is negative, that's going to deepen the neural structures and make it harder to get out of that. Neuroplasticity as well, meditation. Meditation is tuning the brain as an instrument. Just like if your guitar is out of tune and you try to play a chord, it sounds okay, but it's off and you know it's off. Or if your piano needs tuning, you know that when you have it tuned, it's going to be functioning better the way it was designed to. Meditation in our modern world is a way that we can recalibrate our system and get back to our center into a more integrated, healthy lifestyle. Exercise involves health and energy. When you're exercising well, something that's consistent with your abilities and your desires, then you'll feel healthy and energized, and that has a neurological impact on our body as well. Sound therapy for tinnitus introduces sound, which has an effect on the auditory neural response. And of course, that's related to neuroplasticity. As mentioned in part 1, neuroplasticity and neuroplasticity are the same thing. We're talking about the adaptable networks of our brain and neurological system and how that can be changed with repetition and focus. Brain plasticity is a two-way street. It's just as easy to generate negative changes as positive ones. So often, negative changes led us to this place with tinnitus, and positive changes will bring us out of it. Mindset and psychology. Let's talk about the similarities between tinnitus and chronic pain. Tinnitus is invisible, it's not observable, and there's no simple cure. So tinnitus confuses most doctors. Most doctors don't have the right training. Chronic pain is sometimes visible, sometimes observable. There's typically no simple cure, and it also can confuse doctors about what to do. Chronic pain was one of the main conditions that led to the mindfulness-based stress reduction program out of the University of Massachusetts General Hospital, or UMass Hospital, in the 80s. So around 40 years ago, there was a pioneer group who used mindfulness practices with a group of patients who had chronic pain, and their other doctors told them, look, we've tried medication, we've tried some exercise, there's nothing else they could do. That's what they were told. There's nothing else we can do for your chronic pain. You're just going to have to learn how to live with it. And this progressive doctor who had had some experience with meditation and Eastern philosophy, he started this program around mindfulness, and it was particularly designed initially for people who have chronic pain. And what they were able to do is they were able to make improvements with their life with chronic pain. So they focused on mind-body practices and building the strength in those neural networks. And then over time, they were much healthier and stronger related to their chronic pain. So there's parallels to tinnitus here. There's been much more research for chronic pain management than there has been for tinnitus management. And there's big parallels. Both chronic pain and tinnitus affect their own unique parts of the brain. Chronic pain would be the sensory, somatosensory centers in the brain, and tinnitus would be centered with the auditory centers of the brain. But both tinnitus and chronic pain, they have secondary networks that go through the emotional centers of our brain, the limbic system, amygdala, etc. That means it's more than the sensation in itself. It's a complex relationship between how it started, our relationship with why it's there, how we reacted to it over time, any predisposition we have towards stress, anxiety, aspects like that, the psychological response. So we're going to always mention tinnitus and chronic pain, and we're going to dive into that. Let's talk about how to increase neuroplasticity related to psychology and mindset. Positive psychology, the complex neural map between our brains and our bodies is dependent on our psychology. It's no longer the case that the brain is the brain and the body is the body. They're both interconnected, and we see that very much with tinnitus. When our emotional and auditory brain create bothersome tinnitus, it puts our nervous system on high alert, high response, and using psychology can get us out of that high response and into a more long-term healthy life with tinnitus. So when you make actions, when you make consistent actions that are in line with our goals and our desired outcomes for tinnitus management, then it also acts as a way to train our brain. So neuroplasticity is all about repetition, action, psychology, and cognition. In terms of cognition, we have our thoughts, our language, and then our desired outcome. The main research here is coming from behavioral psychology, neuroscience, as well as acceptance and commitment therapy, which studied the power of our repeated thoughts, of the language we use towards ourselves, and our desired outcome. In the tinnitus world, I often hear people describe sufferers. People ask each other, how long have you been suffering from tinnitus? And they describe themselves as tinnitus sufferers. I don't use that term with the tinnitus community because I believe it's a negative neuroplastic pathway that's being reinforced. It's okay to feel like you're suffering for a period of time, but to label oneself a sufferer, it doesn't help you get out of that suffering as quickly. So what the words are important, and the research shows that as well. The different word I would use would be challenges. How I've had challenges with tinnitus, or I am having challenges with tinnitus, or I feel challenged by tinnitus. We can handle challenges with the right guidance and the right framework and model to follow. So that's what we're going to be teaching today about the neuroplasticity framework for holistic tinnitus management. Our desired outcome, as with anything, when we have a goal or a desired threshold that we're working towards, that's going to be ingrained in our system. We're going to be inviting our thoughts and our feelings and our environment that's resonant or consistent with that desired outcome. And we're going to keep away what stops us from reaching that desired outcome. So ask yourself, what is your desired outcome for tinnitus? I advise you not to say my desired outcome is to be completely silent and never have tinnitus again. A more realistic desired outcome for most people would be something like, my desired outcome is to not be afraid of tinnitus. My desired outcome is to spend time with my family, be able to fall asleep well at night, be able to work consistently throughout the day without being distracted by my tinnitus. A desired outcome could be releasing myself from fear of my tinnitus. When your desired outcome is more consistent with that, then a byproduct of reaching that outcome may be your volume of the tinnitus gets softer. So that's how I recommend you move forward. Focus on your relationship with tinnitus as your desired outcome. And over time, that's going to build the neurological pathways where your nervous system chills out, lowers its response, and your auditory and emotional brain can habituate to some degree, so that as a byproduct of reaching that goal, your tinnitus volume and severity can improve. Repetition. Okay, this is the same thing with music, with language, with sports, with exercise. The more you repeat an action, the easier it gets. And in sports, this is described as muscle memory. And it also uses neuroplasticity as well. Psychologically, when we repeat something over and over, like learning an instrument, the auditory aspect of learning an instrument, the more we do it, the easier it gets. The neural systems are stronger, they're deeper, they've had practice. So having daily mind-body practices, keeping your focus, and having an overall macro goal are important for the repetition aspect of neuroplasticity. All right, guys, doing really good. So neuroplasticity research showed that the brain changes its very structure with different activity it performs, perfecting its circuits so it's better suited to the task at hand. This is a quote from a businessman, and I enjoyed this quote because it's saying that our brain is changing all the time, whichever actions we perform. And I'll take that one step further, whatever thoughts we have or whatever techniques we're committed to will change our brain, our nervous system. And if that's consistent with improving tinnitus or our reaction to it, that's what we're after. That's the habituation component here. Let's talk about meditation and yoga. Mindfulness, yoga, and meditation that can lead to positive neuroplastic changes for your tinnitus. So yoga focuses on a healthy spine. You've probably heard us describing the nervous system or the neurological system in our body, and how our tinnitus, we're often stuck in our head, or we're very much in our head with bothersome tinnitus. But to really access the body, we need some methods or techniques or practices to help us move from the head into our body. And the nervous system runs through the spine, right? Yoga is great because it does focus on having a healthy spine, which allows the energy to flow. So a lot of yoga involves stretching, and that's good to relax and as well get into the body, the muscles, the joints, the ligaments, your actual body below your neck, right? You can practice yoga fast-paced or slow-paced. I personally prefer a slower yoga, which allows me to stretch and have a little strength component. I do recommend, if you haven't done much yoga before, to use a teacher and to watch a video online from YouTube, or to go to a physical location and practice with a group. And if you can keep a yoga practice for 2 or 3 times a week, you're doing great. Meditation. Meditation is mental training. A common myth about meditation that I hear from people who try it is they say, hey, Ben, I can't meditate because my mind never stops thinking. Yes, that's what everyone's mind does. My mind never stops thinking as well. The mental training component is to allow myself over time and with practice, you're training yourself that when thoughts come up, you're observing how they come and they go. They come and they go. They come and they go. That process of the mind creating thoughts is ever present. Over time, you develop more peace, more calm in your everyday life as an effect of not feeling so attached to the feelings, thoughts, judgments that come up. And that has a positive effect not only on your relationship with tinnitus, but all forms of life. So if meditation is new for you, that's great. Then you're able to learn the best methods starting right now. If you've practiced other forms of meditation but never had much success, especially with tinnitus, then it's a chance to have an open mind and step into meditation for tinnitus in a new way. Talk about the witness mind, and the witness mind describes how when I'm in meditation with my eyes closed and I'm breathing, and I typically recommend guided meditations, and I make some guided meditations here. So in the meditation, I can practice myself being the witness mind, being the witness, observing thoughts come and go. So those thoughts are coming into my mind and they're going. And I'm witnessing, I'm observing, I'm watching. Thoughts come, thoughts go. I'm breathing throughout, thoughts come, thoughts go. That's called the witness mind, and it allows you to separate yourself from the negative self-talk about your tinnitus, or separate yourself from the worry, fear, anxiety, stress that we all have in life. And that's why so many people love meditation, because it brings them back to their center, into that place of more calm and control. You can meditate in silence, or I recommend for most people using some pleasant background noise as sound therapy while you're meditating. The idea of being in silence, most people who have bothersome tinnitus don't want to do that, and I understand completely. So the way you can still meditate with tinnitus is to find a sound that you enjoy and to play that sound in your room that you plan to meditate. Play the sound at a loud enough volume so you can relax and you're not super stressed by the loudness of your tinnitus. Then go into your guided meditation, and you won't be so burdened or challenged by the tinnitus sound during your meditation, which is designed to relax you. If you're not feeling relaxed in your environment before you even start meditation, it's going to be hard to get into that calm center place. All right, guys, doing awesome. So how do we increase neuroplasticity related to yoga and meditation? I looked at some awesome research of literature reviews and high quality research online, and I found that yoga can have a positive effect on depression. So research studies have shown there's a neuroplastic mechanism that can improve the overall feeling of joy and feeling happy or neutral. That would be an improvement from a place of feeling depression. Additionally, yoga for chronic pain. As we discussed earlier, chronic pain is very much similar to tinnitus in its neurological makeup. So yoga for chronic pain is a way to tune the body and had positive effects for individuals with chronic pain, specifically in their short-term symptoms. So when they had pain, doing yoga, the research showed that their pain wasn't as bad. And that may be physical pain, that also may be accessing the emotional centers of the brain and the nervous system that can have an indirect effect on the pain itself. And that's, in my perspective, how yoga can be beneficial for tinnitus. It's not designed to affect or improve the tinnitus directly, but indirectly through those emotional centers and the nervous system, it can have a positive effect on pain. So there was an amazing research study that looked at meditation for tinnitus, and it results in less stress, and a better relationship to tinnitus for most of the subjects, not for everyone. And that's important here, is that with these mind-body practices, it's not a one-size-fits-all. It's really here, take these 4 or 5 techniques, go practice them and try them with all of your heart and energy, and be honest, which ones worked, which ones weren't your style, which ones did you not connect so much with, and then which ones had a positive effect. If you find a few that have a positive effect, then stick with them, develop a consistent practice, and you're going to see results. Yoga and meditation lifestyle. There was a research study that showed that yoga and meditation and lifestyle had a positive effect for depression severity. So this means every week, if you have some consistency where you're practicing some physical movement, yoga, stretching, focusing on your healthy spine, and you have these contemplative meditation practices as well, that kind of lifestyle has a positive effect in your overall well-being, health, and energy. Habits of thinking need not be forever. One of the most significant findings in psychology in the last 20 years is that individuals can choose the way they think. Let's talk about exercise for neuroplasticity with tinnitus. There's 2 types of exercise. There's aerobic and anaerobic exercise. Aerobic exercise, it's what we recommend first. Aerobic exercise means long-term sustained cardiovascular movement and a lot of oxygen. So this would be something like swimming, walking, running, biking. Those are aerobic exercises. Anaerobic exercises is short-term burst energy, and that's typically related to more muscular things or sprinting. So how do we increase neuroplasticity related to exercise? Let's get into it. The research review. Aerobic exercise involves sustained movement, a lot of breath and breathing as well, and that leads to getting fresh oxygen into your whole system. Very important. Anxiety. Anxiety typically involves worrying or a high alert response. Stress can come from our emotional experiences in life. It can also have a physiological effect on our nervous system and put us on high alert, which we so commonly see with tinnitus patients. That physiological body response can be improved by exercise. So again, what we're focusing on here with neuroplasticity for tinnitus, there's no neuroplasticity button or direct action we can take towards the tinnitus where I'm controlling it, I'm reducing it, I found it, there it is, I'm better. It's an indirect response. So for exercise, when we can improve the physiological body response, the stress response, then it can have an indirect impact and improvement on tinnitus. Now, depression can often feel like you're down and out or you're feeling off, and exercise is a research proven technique, especially aerobic exercise, to improve depressive symptoms and to bring us into a state of higher energy and fulfillment. We are shaped by our thoughts. We become what we think. We are shaped by our thoughts. We become what we think. When the mind is pure, joy follows like a shadow that never leaves. How will you purify your mind so you can find joy? Sound therapy. Sound therapy is another neuroplasticity component for tinnitus. Let's get into it. So as we spoke about in the neuroplasticity part 1 of this workshop, which was last month's workshop, negative neuroplasticity causes tinnitus. And that starts with sensory deprivation of some form of hearing damage to the auditory pathway, either prolonged over time or instantaneous from a loud noise exposure. And that has a physical origin of tinnitus in the auditory brain. that signal is amplified and made into a problem in the emotional brain. And that creates a high stress response in our nervous system and brings our whole body into high alert. So how do we increase neuroplasticity related to sound therapy for tinnitus? All right, guys. So this is a big one. Ear level sound therapy. That means the sound coming in is coming in through your ears, and you can present it either from a speaker in your room or through headphones in your ear or through hearing aids on your ear. For sound to have a positive neurological effect on your tinnitus, a lot of this is coming from the classic tinnitus retraining therapy models. The sound needs to have a neutral or a positive emotion with it. So if you're using white noise to help your tinnitus, but you really don't like white noise, it sounds bad to you, you're only using it because one of your doctors recommended it, or you saw it online, someone said, hey, use white noise, it helps tinnitus. If every time you put on the white noise machine and you go, oh, I don't really like that, but I guess I'll use it because I need some help with tinnitus, then if that's your case, don't use the white noise. Find a different noise that has a neutral or positive emotional reaction to it. Personally, I grew up as a beach lifeguard in Rhode Island, and I have been surfing for 7 years. I love the ocean. I love the sound of waves. So for me, if I'm using sound therapy for tinnitus, I would find the most relaxing, emotionally soothing sound of the ocean. And that would be my stimulus for sound therapy to improve neuroplasticity with tinnitus, okay? So when we have a sound that's playing and interacting with the tinnitus in our auditory brain, the sound doesn't need to be so loud, it just needs to be audible. That leads towards habituation for tinnitus, which a lot of times is what we're after. Having a controlled action. So in this case, your controlled action is consistency with using sound therapy to improve habituation. That's what you have control over. There's no button you can press to habituate faster, and there's no button to press to make your tinnitus softer. But you can indirectly impact habituation and the quality or loudness of your tinnitus through your controlled action. And in this example, the controlled action would be consistently using sound therapy. For most people, this will be when they're falling asleep at night to help them enter sleep more easily. For other people, they use it throughout their day. Do you have hearing aids? Do you have a hearing loss? Would be another question. So traditional sound therapy does not need hearing aids, and it could be something as simple as a fan in your house, using white, pink, or brown noise samples that you find online through a speaker, or using a bedside noisemaker that has some sounds of the ocean, sounds of the forests, white noise, other kinds of whooshing noises. Or you can use online sound files where you go on YouTube or Spotify or SoundCloud and you find some amazing tracks, some amazing sounds to help your tinnitus. Then you play those through a speaker and that interacts with your auditory system and can help with habituation in that way and calm the whole system. If you have hearing aids, then it's a little different. You can have sound therapy programmed on the device itself. So you press a button and it plays in your ear. The powerful thing about wearing hearing aids for sound therapy is that you can wear them throughout your day and you can have soothing sounds whenever and wherever, as long as you're wearing the devices. No one else in your space or in your room will hear the sound therapy. So if I was in a work meeting and I played ocean waves on my phone for everyone to hear, and I didn't have hearing aids, then people would say, hey, Ben, you got to turn that off. We don't really want to feel like we're at the beach. We're in a business meeting. But if you have a hearing device, and it's basically invisible these days, and you have that streaming from your cell phone, and if I put on ocean sounds through my phone, and that goes to my hearing aid, my device, and I'm in my work meeting, I can feel relaxed and not be overwhelmed by the tinnitus. No one in the room knows I'm listening to ocean noise, and I can hear what everyone else is talking about, and I can communicate with them normally. So that would be a case where you might want to consider hearing aids or for sound therapy. And you can contact me if you're wondering who to go to or getting a referral to the right kind of hearing aid or the right specialist to help you out. So the hearing aids can use Bluetooth streaming through a smartphone, and then you can play any sound you want, either through a tinnitus app or through Spotify, YouTube, something that plays soothing noise that helps you relax with your tinnitus. All right, guys. So this has been neuroplasticity for tinnitus. Now, let me explain the way that I recommend here at Pure Tinnitus we find positive neuroplastic changes for our tinnitus. The way involves mindfulness, psychology, meditation and yoga, exercise, and sound therapy. These are all proven methods to improve the neuroplasticity of your system. And when you take consistent action and have practices and a schedule, a routine, over time, you're going to experience positive improvements. As I mentioned earlier, this may have an indirect improvement with your tinnitus. If your meditation or exercise practice helps your stress response in your body and calms you down and improves the way you're showing up every day with yourself and with your family, oftentimes that will have an indirect improvement with your tinnitus, and the quality or loudness of your tinnitus will get better. Or if you get tinnitus spikes where it's bad for a few days, then it gets better. Those spikes might become less intense or shorter in duration. The important thing here for neuroplasticity for tinnitus is that you realize, even though these are methods, I encourage you to try all of them, you're going to find certain aspects of these mind-body practices or sound therapy that work best for you. There's going to be other components that may not resonate with you. And at the beginning, when you're trying something new in regards to the mind-body practices with tinnitus, it takes time, it takes patience. I sucked at meditation. It was really hard for me for a long time, but I kept at it. If you've never done yoga before, then try to focus on some basic stretching and yoga exercises that can keep your spine healthy and allow your whole system to improve related to your body, your emotional reaction, your nervous system, and your tinnitus. So these are the ways I recommend and the ways we covered in this discussion for how to achieve positive neuroplasticity for tinnitus. My question for you is, do you honestly believe you can do this? Do you believe you have the resources internally, the desire, the motivation to take action? Do you believe you have the right environment around you to get this done and consistently show up for yourself? And do you believe you have the time? Do you believe you have the energy and the time to do this the right way? Those are some important questions for you. This has been Neuroplasticity for Tinnitus. Really excited that you're here. And as a reminder, before you go, make sure you comment below on this video. Make sure you comment in the Facebook group, because you are not alone. You're watching this most likely alone, most likely the only person with tinnitus in your room, but you're in this space where there's other people like you who are motivated to improve their relationship with tinnitus. And those are your friends. Those are your mentors, your guides. I am here to support us all in improving our relationship with tinnitus so we can live our best life with tinnitus. It's been a pleasure to host you. Make sure you do comment below about what you learned in this video. Keep showing up, keep doing the work, stay at it, don't give up, Let us know if you have any questions. We're here for you guys. It's been a pleasure. We'll talk to you real soon. And remember to take your journey one step at a time. Stay involved with Pure Tinnitus, guys. Take care.